Bismillahirrahmanirrahim. In these slides, we are going to discuss about the osteology of leg, which includes tibia, fibula, and foot bones. Now, first of all, we are going to discuss about tibia and fibula side by side. This diagram shows the anterior view of right leg, the posterior view of right leg. These are the superior view, the cross section of these two bones, and the inferior view. Now, first we are going to discuss something about the salient features of tibia. Tibia is the largest bone of the leg as compared to the fibula. This bone lies medially and fibula lies laterally. Most of the weight. Instead, if we say that all of the weight bears through tibia and fibula is just a stabilizing bone. Both of these bones are the best examples of typical long bone. The typical long bone have upper end, shaft, and lower end. Now let's discuss these two bones in detail. First of all, tibia. Tibia have upper end. Upper end of the tibia carries two condyles, intercondylar area, the shaft, and the lower end. Going into the detail of the upper end, following structures are going to be identified in these diagrams. The two condyles are the medial condyle and the lateral condyle. In this diagram, in anterior view, this one shows the medial condyle, which articulates with the medial condyle of femur, and this one is called lateral condyle, which articulates superiorly by the femur and inferiorly by the head of fibula. Now the intercondylar area shows two eminences known as lateral intercondylar tubercle and medial intercondylar tubercle. This is anterior view and this one is the posterior view. This area is known as posterior intercondylar area. And in superior view, you can identify these structures here and this one. The two menisci present in between the condyles of femur and condyles of tibia as a cushion-like structure known as menisci. Here is lateral meniscus and this space is for the medial meniscus. These two tubercles give the attachment of anterior and posterior cruciate ligaments of the knee joint, which you have already discussed in knee joint chapters. Now let's discuss about the shaft. The shaft of tibia is somehow thickened and prismoid in shape. It has three borders: anterior border, medial border, and interosseous border. Interosseous means in between two bones. The interosseous membrane also originates from here. So this border is interosseous border or lateral border. The three surfaces, which are lateral surface, medial surface, and posterior surface. The anterior border is S-shaped and sharp. This is S-shaped border and little bit sharp. The medial border is rounded, and the interosseous or lateral border extends from the lateral condyle a little below and in front of fibular facet, where the fibula attaches to the anterior border of fibular notch. Following the border lines, let's identify the surfaces of tibia. There are three surfaces which I have already mentioned. Let's identify. The surface lies between anterior border and interosseous border. This surface is called the lateral surface. This is lateral surface. The posterior surface lies between the medial border and interosseous border. Interosseous border is this, and this one is the medial border. This whole area is the posterior surface of the shaft of tibia. It is widest in the upper part and is crossed obliquely by a rough ridge called soleal line. You can see the Newton foramen on the upper one-third of posterior surface of shaft of tibia. The Newton foramen is the widest and largest foramen and it is supplied by the posterior tibial artery. It is the biggest nutrient artery of the body. Now the last surface is medial surface. It lies between anterior border and medial border. You can feel this medial surface because this is throughout subcutaneous. One feature which I left is tibial tuberosity. You can feel this tibial tuberosity with your hands just below the knee joint. The last part of tibia is the lower part. The lower part of tibia is slightly expanded. It has 5 surfaces. Anterior surface, lateral surface. The anterior surface is little bit smooth. The lateral surface have a notch for the placement of fibula at the distal end. The inferior surface gives the attachment to the foot bones. The posterior surface is little bit smaller and grooved. And the medial surface shows medial malleolus, which is expanded part. You can feel this medial malleolus on the medial side of the foot at the ankle joint. So this is all about the tibia. Now let's discuss about the anatomical features of fibula. Fibula is the thinnest bone of the leg. It lies lateral to the tibia and having all these 3 similar features such as the upper end, shaft and lower end. The upper end of the fibula shows head and having a pointed structure known as apex. Just few centimeters, 1 centimeter below the head is the neck of the fibula, which is thin, and from the neck the shaft starts. The shaft shows similar features as compared to the tibia. It also have 3 borders and 3 surfaces. The 3 borders are anterior border, posterior border and interosseous border. Let's identify these borders in these 2 diagrams. This one is called anterior border. This is called posterior border, which is more clear in the lower 1/3 of the posterior side of the bone. And the last border is called interosseous border or medial border. Now we are going to find these surfaces, the 3 surfaces in between these borders, which are medial surface, lateral surface and posterior surface. The medial surface lies between anterior and interosseous border. This one is very thin medial surface, lies between anterior and interosseous border. This thin area is medial surface. The lateral surface lies between anterior and posterior border. We can find lateral surface here. This one is the lateral surface and this border is the posterior border. Lateral surface. The posterior surface lies between the interosseous and posterior border. This border is interosseous and this is posterior border. This whole surface is the posterior surface. This posterior surface is mentioned here. The posterior surface is the largest of all these 3 surfaces. It has a vertical ridge called medial crest. Now comes the last part of fibula. The lower end of the fibula have 4 surfaces and the tip of the lateral malleolus is 0.5 centimeter lower than the tip of the medial malleolus. You can see this difference in the diagram. The 4 surfaces are anterior surface, which is smooth and rounded, the posterior surface, which is grooved, the lateral surface is subcutaneous, and the medial surface, which bears a triangular articular facet for the talus anteriorly and the malleolar fossa posteriorly. So that's all about the tibia and fibula. The next topic is the bones of the foot. This is a skeleton of a foot of a human. Now going to identify the bones. First of all, from superior to inferior and from proximal to distal. These are as follows. This bone is called talus. It articulates superiorly with inferior part of tibia to form the ankle joint. This is the talus bone, and inferior to the talus, this bone is called calcaneum or calcaneus bone. This is also known as heel bone. Now distally, two bones are there. Medially, the navicular, and laterally, cuboid. And more distally, three cuneiform bones are there. These are as follows: the medial cuneiform, intermediate cuneiform bone, and lateral cuneiform bone. Now comes the metatarsal bones. From medial to lateral, first, second, third, fourth, and fifth metatarsal bones are there. Three phalanges for each finger and two phalanges for big toe. The proximal and distal. These one are proximal, middle, and distal for each fingers. So you can have a good insight on this picture about the dorsal view of bones of the foot. Thank you very much.